All right, let's dive into a real medical puzzle, neurogenic thoracic outlet syndrome. It's one of those conditions that's incredibly tricky to pin down, but really crucial to understand.
So let me ask you this. What if the nagging pain, that weird numbness, or that weakness in your arm wasn't actually coming from your arm at all? It's a strange thought, right? But it gets right to the heart of neurogenic thoracic outlet syndrome, or nTOS for short. The real culprit is actually hiding up in your neck and shoulder.
And it's such a mystery because the symptoms are just a confusing mess. We're talking about pain that shoots down from your neck, bizarre tingling sensations, maybe a hand that just feels weak. And the craziest part, it can all get worse from something as simple as raising your arm over your head. You can imagine how frustrating that is to live with.
Now, to put this all in perspective, thoracic outlet syndrome in general is pretty rare. But the neurogenic type, the one we're talking about, nTOS, that makes up a massive 95% of all cases. It makes sense, really, because that little space is packed with nerves, making them the most likely to get squeezed. So when doctors see TOS, this is almost always the version they're up against. So to really get what's going on here, we have to look at the anatomy. The best way to think about it is like a super crowded highway, but with a major bottleneck where all the traffic is getting squeezed into one lane. This bottleneck has a name, the thoracic outlet. It's this incredibly tight little tunnel, bordered by your collarbone on one side, your first rib on the other, and a bunch of muscles all around. And guess what? All the essential wiring and plumbing for your entire arm has to pass right through it. And the most critical piece of that wiring is something called the brachial plexus. Just think of it as the main data cable carrying all the signals from your brain to your shoulder, your arm, and your hand. In nTOS, this is the exact cable that's getting pinched, and that's what's causing all those mixed signals, like pain and numbness.
Now, this compression doesn't just happen randomly. It happens at very specific choke points along this highway. The most common spot is called the scalene triangle, which is tucked right between your neck muscles. But it can also happen a little lower down, between your clavicle and first rib, or even behind one of your main chest muscles.
So what's causing this big squeeze in the first place? Well, it can be a bunch of different things. Sometimes it's just the way you're built. Some people are born with an extra little rib in their neck. But a lot of the time, it's triggered by trauma, like whiplash from a car accident. Or it could be from repetitive overhead motions, think athletes or people in certain jobs, that cause muscles to get too big and crowd the area.
Okay, so figuring this out, well, the diagnostic process can feel like you're running a gauntlet. And that's because nTOS is an absolute master of disguise. It looks like a whole bunch of other things.
And this is the core challenge right here. The symptoms, that pain, numbness, and weakness, look a whole lot like a pinched nerve in your neck or carpal tunnel syndrome. So doctors can't just go by symptoms alone. They basically have to become detectives to rule out all the other suspects and prove that the thoracic outlet is the real crime scene.
To help with that detective work, experts created a kind of diagnostic checklist. To really be confident in an nTOS diagnosis, a patient usually needs to check boxes in at least 4 of these 5 categories. It's not about finding one single smoking gun, it's about building a really strong case based on a whole pattern of evidence.
So the investigation follows a pretty clear path. First, you start with a deep dive into the patient's history. Any injuries, any repetitive movements at work or in sports. Then comes the physical exam, which includes these provocative tests, like having someone hold their arms up for a few minutes to see if it brings on the symptoms. From there, you use imaging and nerve studies to rule out other problems. And then, you might move to a final, really key step, a diagnostic block.
Now, this diagnostic block is super important, and here's why. It does 2 jobs at once. A doctor injects a numbing agent right into the scalene muscles in the neck. If the patient's symptoms just vanish for a little while, that's a huge clue that those muscles are the problem. But even better, a positive response is a fantastic predictor that the patient will have a great outcome if they end up needing surgery down the line.
All right, so the diagnosis is finally confirmed. The focus then shifts to relief. And there are really 2 main paths to get there, the conservative route and the surgical one.
The first line of attack is almost always physical therapy. And you know what? For a good chunk of patients, around 27% in one study, physical therapy by itself is enough to provide satisfactory relief. They never even need to think about anything more invasive.
So let's compare these 2 paths. With physical therapy, the whole goal is to decompress that crowded area by fixing your posture and strengthening other muscles, like your core and diaphragm, to take the strain off your neck and chest.
This is the perfect first step for patients who don't have major muscle weakness. Surgery, on the other hand, comes into play when PT just isn't cutting it, or if there's already some muscle loss. The goal there is much more direct. Go in and physically create more room for those nerves.
Now, for the people who do need surgery, it's not a one-size-fits-all deal. Surgeons have a few different ways they can tackle the problem. They can go in through the armpit or from just above the collarbone. Some procedures actually remove that first rib to create space, while others just focus on releasing those tight muscles. There are even minimally invasive video-assisted options now.
And this brings us to a really important point. When you look at the data, the complication rates are pretty different depending on the approach. The older methods that involve taking out the first rib have higher rates, one close to 15%. But the rib-sparing technique, where they only remove muscle, the complication rate drops all the way down to just 3.6%. You can see why that's becoming a much more popular option.
But let's be crystal clear. When it's needed, surgery can be a total game changer. One study that compared outcomes head-to-head found that while PT definitely helped reduce disability, the surgical group saw a much bigger improvement. For the right person, it could be the most effective way to get their life back.
So, after going through all of that, what's the big picture here? Why does getting to the bottom of this mystery actually matter so much?
The most crucial point is this: nTOS is not a simple problem with a simple test. It is a complex puzzle. It's about how your unique body, your anatomy, interacts with an injury or just repetitive stress to create this very specific and frustrating set of symptoms. Getting to the right answer isn't a single event. It's a journey that requires patience and some really careful detective work.
So if you take anything away from this, let it be these things. First, that classic sign of symptoms getting worse when you raise your arm, that's a huge clue. Second, remember that diagnosis is a process, a journey of elimination. Third, treatment has to be tailored to the individual. There's no one-size-fits-all solution. And finally, being your own best advocate on this journey is absolutely essential.
And that leaves us with one final thought. We've been talking about a condition that's defined by physical compression, a physical squeeze. But for the people who've spent months or even years searching for an answer, maybe the greatest relief of all isn't just the physical treatment, but finally understanding what's been going on in their own body all along.